Thank you, Speaker. Speaker, I'm sure you know that the challenges facing long-term care homes are real. They are serious, they are long-standing, going back many years. There are problems and they must be fixed. Today's opposition motion is correct in this respect. The impact of COVID-19 has been devastating. As a province and as a government, we grieve with those families who have lost loved ones in long-term care. Ever since I was first elected, I have advocated for long-term care homes in my riding. I have advocated for the staff, the families, and residents that I represent. I have advocated for homes in all sectors, for profit, not-for-profit, and municipal homes. And in Perth-Wellington, we have dedicated staff and administration in homes of all types, working hard for the residents in their care. I have advocated for more beds and more resources, and I have advocated for beds in rural and small-town Ontario in particular. In 2017, when the former government was considering a proposal to transfer up to 50 of our beds out of Perth County, we stopped it in its tracks. And do you know what we found? People care about long-term care. They understand its value so much that they are willing to mobilize, to write letters, to sign petitions, to speak up for their families and communities. When there are challenges in long-term care, people take notice, and that's what we're seeing here again today. Yet for all the challenges we are seeing, it would be simplistic and incorrect to say that it's all bad news. In June, I spoke in the legislature about homes in Perth-Wellington and how they responded to the COVID-19 crisis. I said in part, people who worked long hours away from their families, people who pushed themselves, working way beyond their job description, people accepted the risks not knowing how much PPE was left or whether they might come down with COVID. And people kept coming back to work day after day. I want to thank them. I want to thank them at every home in Perth-Wellington. The rest of us will never know fully their contributions. I also want to thank the people and businesses who donated PPE, food, or finances. But there's more that we can do to help. For many families unable to visit loved ones, it's been a long, tough road. We want to visit them, and they want to see us too. In September, I again raised long-term care in this legislature. I spoke about the challenges ahead of us. I said many more of us will need long-term care. We'll need more staff, PSWs, nurses, administrators, activity coordinators, volunteers, and many others. We'll need modern, accessible buildings because these buildings are the residents' home. We'll need them in the cities, in small towns, and in the country. And all of them will need to be prepared for future pandemics. Our government has heard this message, and it is responding to that need. I would like to name just one example. In November, we announced that direct care provided to each long-term care resident will increase to an average of 4 hours per day. That will mean educating and recruiting tens of thousands of new personal support workers, registered practical nurses, and registered nurses we need. We'll need, of course, in the wake of this tragedy, that met so many long-term care homes during COVID-19, the government established the Independent Commission. Its goal was to provide a timely, transparent, and nonpartisan investigation and to deliver advice on better protecting long-term care homes, residents, and staff. The commissioners continue to do that, and they are doing good work. From the beginning, the Commission was asked to provide its final report by April the 30th. That's because the situation was urgent, and it's still urgent. Even as the Commission is still completing its work, our government is not waiting to act. I want to talk about 3 key areas of the Commission's interim recommendations: infection prevention and control, leadership and accountability at our homes, and inspections. Improving infection prevention and control has been a major priority of this government. The Commission has already made some recommendation on this, and we are acting on them. They recommended that every long-term care home have a dedicated and accountable infection prevention and control lead. They recommended that all staff have basic training and access to the local infection prevention and control center of expertise. Today, I'm told we have infection prevention and control hubs and outbreak management teams in place to support homes. We are also funding dedicated personnel for training and education and much more. I am pleased to see that the ministry is collaborating as outbreaks occur, hiring more inspectors and evaluating resource needs. Another recommendation was to increase testing for residents and staff. As of last week, I'm told that Ontario Health has shipped more than 125 million rapid test kits to 521 long-term care homes. Another theme from the Commission's recommendations is leadership and accountability. The interim recommendation was to require a lead for quality of care in long-term care homes and to fund it properly, and the ministry is responding. The Commission's made two recommendations around performance indicators and accountability. The first recommendation is that we include performance metrics such as resident and family satisfaction, staff engagement, staffing levels, and supply of PPE in long-term care home performance reports. The government is developing a quality framework for this purpose. I've always believed that residents and families need to be involved and they need to be heard. And I'm so very pleased the government is listening to their views on quality of care and quality of life. The second interim recommendation is that we publicly post performance reports so that the people can see for themselves how their local homes are working. The ministry is working on this to support informed decision-making by and for long-term care residents. Finally, the ministry is working to do the inspections necessary to keep homes safe. During the pandemic, ministry inspectors have continued to look for risks of potential harm to residents. They are also responding to concerns from residents and families. Where there are critical issues, we're making sure that homes have what they need to fix them. The ministry has also heard concerns from the public and the commissioners about the frequency of inspections. That's why the ministry is looking at proactive inspections. This will complement inspections responding to complaints or critical incidences. The final recommendation calls for better collaboration and information sharing between ministries. Long-term care homes are inspected by the Ministry of Long-Term Care, Public Health Ontario, and the Ministry of Labour, Training and Skills Development. Homes are inspected and inspected again. I have often said there are so many good homes and so many dedicated staff members who work there. They are working hard, to say the least, but we need more of them. Our government is on track to build 30,000 new long-term care spaces over 10 years. We need these beds, and we're getting ready to build them, even during a pandemic. The modernized funding will help. The modernized funding model will help. For homes in Perth-Wellington, it will mean about $991,000 for homes in every part of the riding. We're also going to make sure that every new home is built to modern standards. They will consider infection prevention and control and containment, and they will replace ward rooms with single and double occupancy rooms. In November, the government announced 29 new development projects across the province. These will create almost 2,000 new spaces and over 1,000 upgraded spaces. Today, we have over 22,000 safe, modern spaces in the pipeline. We need to keep going, and we need to keep working. Finally, Speaker, I would like to tell you about an incident in Perth-Wellington which just makes me so proud of how people can work together. We had a couple outbreaks in some long-term care homes. Our public health team and our family health teams jumped in and mitigated the outbreaks in a very short manner of time. And that meant that patients that had to go to hospitals were located in hospitals. That meant patients that could stay in their homes stayed in their homes. Workers who had the COVID-19 were certainly isolated, and these outbreaks were contained, and they were over in a very short period of time. So I want to take a shout out to all the healthcare workers, especially those involved in outbreaks, that mitigated the circumstances and made sure in our homes now are not in outbreak. Not one of them are in outbreak right now. So I want to say thank you to all those people and to those in my riding of Perth-Wellington. Thank you.